Hypovolemic shock is a medical emergency that occurs when the body doesn't have enough blood volume. It can be caused by several factors, including catastrophic bleeds, which is defined as a sudden and severe loss of blood. When a person suffers from a catastrophic bleed, their body can lose a significant amount of blood in a short period of time. This can lead to a rapid drop in blood pressure, resulting in hypovolemic shock. Symptoms of hypovolemic shock may include pale or clammy skin, rapid breathing, rapid heartbeat, and confusion. In severe cases, the person may lose consciousness. If left untreated, hypovolemic shock can be life-threatening. That's why it's important to seek medical help as soon as possible if you or someone you know is experiencing a catastrophic bleed. The treatment for hypovolemic shock by the emergency services typically involves replacing lost blood volume with fluids such as saline solutions or blood transfusions. In some cases, the person may also need medications to increase their blood pressure. In first aid terms, we cannot do this, so we must allow as much spare blood in the body to flow to the vital organs. We do this by raising the patient's legs 15 to 30 centimeters to allow the blood in the legs to flow back into their body. This is a short-term but effective fix to get more blood where they need it the most. In addition to elevating their legs, we need to also keep them warm. This will help with the blood flow, helps the clotting process, and makes them feel more comfortable. We do this by covering them with a blanket, a foil blanket from a first aid kit, or cover them in any spare clothing you have, but make sure you can still see the injury just in case it starts bleeding again. And if covered, you may not notice this. Keep talking to the patient, monitor their signs, especially their breathing.